Hi, I am Dr. Julie Brown. I am a CARET-trained, board-certified chiropractic neurologist, and I also hold a fellowship in traumatic brain injury and rehabilitation. Today I'm going to talk about a common patient I see that I actually enjoy treating and working with, and it is my dizzy or vertiginous patient, or patient with vertigo. I want to talk about the differences between the two. Vertigo is related more to a really strong spin, the world spinning or you're spinning, and you may want to fall really hard to one side. Dizziness I describe more as a lightheadedness, and you get up and you're unstable, but there's not a really strong direction to it. And the reason I want to identify these two things is they can come from different organs, and one may come more from the brain versus the organ. It just helps me differentiate the cause of why it is happening. This is a vestibular system. This is actually the one that's on the left. And it is about the size of the tip of my thumb, and it is in the temporal bones, and it is full grown at 6 months old in utero. So that's when the baby starts moving, and these pathways really start growing to the brainstem and to the cerebellum and to the frontal lobe. The canals are these things. You have the anterior, posterior, horizontal, and they tell us if we're accelerating or decelerating, and they also tell us if we're turning. And these things are related a little bit more to that vertiginous, that really strong vertigo feeling, and we may do a different therapy for that. The other thing that we have are called otoliths, and they perceive gravity all the time, and there are these haphazard crystals that sit in there. So we may, if you're in an accident or had a concussion, disease, whatever it may be, we need to just teach those crystals to kind of adapt to their new position, where in the canals, we may need to stimulate those canals to get the hairs to deflect and move the way that they are supposed to. Another way this can present in my office is with nausea, just upset stomach. So when you go on a roller coaster, you know that you kind of have that upset stomach because the information, the sensory information comes into that brainstem and can make you feel nauseous. So somebody who's nauseous and somebody who has neck stiffness. When your world is unstable, when your vestibular system is not doing what it's supposed to, I look at the neck as another sensory organ, and it just reflexively holds the tone of the muscles in the neck and holds them tighter to help stabilize your world. So somebody may not necessarily have dizziness or vertigo, but their neck is stiff. So I always check out that vestibular system to see how it's working. Back to the vestibular system specifically, we can do therapy. You could have an otolithic problem on one side and a canal issue on the other. It's a matter of identifying it. I use the eye movements. I use touch localization. There are many things that I use to try to pinpoint where the problem is. You can have a problem in the organ. You can have a problem with the nerves that go to the frontal lobe, directly to the cerebellum. The frontal lobe and the cerebellum or the brainstem may have an issue. So the proper thing to do is to identify where the treatment needs to start. I may need to start in the frontal lobe and then stimulate the canal so that those pathways get stronger. I may just do canal and it gets better. There are many different options. I commonly see this in my practice. It's not in the research, but many of my patients in the practice are women, and they tend to be in their 40s, working, career, stressed, and working in career could really be a stay-at-home mom also. That is a lot of work. But their hormones are starting to change, and they can't adapt to the stress the same. And that can change the density of your bones. That can change the effect of the hair. Your diet may be an issue, not enough protein or insulin surges. There's many things. You have to identify it. If you have any questions, feel free to email me, call me. I offer a free 20-minute consult. But the reality is you need to identify what is causing the symptom. Thanks.